guys. Today I'm gonna answer a question that came from Italy, from my colleagues in Sardinia and also Rome. One is a professor of Cagliari University that asked me about the role of hypermobility evaluation in the field of chiropractic practice. For example, the use of Bayton score in the field of chiropractic technique. Why to perform this test? Why to evaluate hypermobility in the chiropractic diagnosis? Why to have this test inside of chiropractic clinical practice? Well, there is three different points that the hypermobility evaluation and Bayton score is important. First is the risk. Okay, we consider that the hypermobility evaluation Bayton score is very useful to detect the risk for manipulation or adjustment. And this risk factor is considered the changes in the collagen tissues. Okay, it's not only in the joints, but in all tissues in the body, including the nervous system and vessels. And these can bring a predisposition to have dissections in arteries. And then the first point in the risk is detection of risky predisposition of dissection of artery, and also to exclude the diagnosis, to make a screening methodology to collagen disease. For example, Stickler, Besset, and Ehlers-Danlos and Marfan disease in some patients. And then detect that this pathology will be the screening. For example, more important in some subclinic condition of Ehlers-Danlos syndrome, then this would be very useful to entail this patient to rheumatology or genetics evaluation further. Okay, and after detection of the risk, we have the question of diagnosis. There are some cases that we detect hypermobility, and this global hypermobility is not a malignant situation. We don't have a collagen disease, but also we have a condition that is related with generalized pain, and then is very useful for diagnosis of to develop strategies to treat this generalized pain, not only considering the manipulation or the adjustment. And then when we detect this tendency to have generalized pain, we also contribute for the prognosis of the proper patient. And the third thing is to determine also the chiropractic treatment. Okay, and also use the information in the clinical condition in case of a benign hypermobility to develop the treatment plan for this patient. And then global hypermobility in benign patients, that the patient that don't have risk for dissection of artery, don't have risk for fractures and for bone avulsion or joint avulsions. This patient with hypermobility, global hypermobility, we are not understand an exclusion for manipulative therapy. Okay, they sometimes have some fixation, but because the common sense is think how this patient have higher mobility, have a hypermobility and a higher Bayton score, for example, 7 from 9 points in Bayton score. Some clinics may think that these patients don't need chiropractic high velocity low amplitude technique because this patient is hypermobile, and but it's not like that, because against gravity, even a hypermobile patient will develop some areas with fixation, and that area will counterbalance that area with higher mobility. And when they develop a movement the organism that develop movement, any organ that develop movement against the gravity will develop also some sort of restrictions, and this restriction may be a target for manipulations, for adjustments. Of course, these adjustments should be well directed. It would be really less adjustment than the major part of the patients, but this adjustment can be performed with success, with no risk of side effects for this patient, and can be also useful to pain control, and also a prescription of exercise, and also segmental hypermobility, and also considering that this patient have more tendency to develop generalized pain. Okay, and then I guess it's enough. These are 3 points that we discuss about the value of the evaluation in hypermobility, and then the point of determine the risk and make be useful for diagnosis of pain and the prognosis of pain, and also to help us to develop a plan of treatment for this type of patient. Okay, thank you.